And then we're talking about another entity. This one is neurofibroma. So this entity is kind of different from the PEN and the schwannoma. Even from the low power, we can see this kind of a exophytic growth nodule in the dermis. And we can see kind of pale stroma. And when we zoom in, we can see clearly spindle cell tumor. But this spindle cell do not forming any structure. You can see they just like a swimming dolphin, spurs haphazard distributed in the stroma. They do not have a really well demarcated area to tell you where is the normal dermis, where is the neurofibroma area. So kind of intermingle together. So when you see this spindle cell, especially in low power, you do not see any vesicular growth, any storiform growth, any varicane body, all of the feature like this. You need to think about whether it is a neurofibroma. So when you zoom in, you can see different kind of spindle cell. They look different. And then you can also see these guys. This is mast cell, because for this pale looking stroma, neurofibroma, usually we have this kind of myxoid material. Anytime when you see myxoid mucin area, you will see mast cell. So what are the components of the neurofibroma? Usually all of these spindle cells, there are three components. One is one cell. Around 50% of this spindle cell is one cell. So when you do S100 staining in neurofibroma, around 50% of the cell will be staining positive for S100. But there are another component in the neurofibroma other than one cell, that is perineural cell or perineural-like cell that is positive for EMA, just like what we do the staining with the PEN in the periphery. And then another component is fibroblasts. So you can also use CD34 to highlight these fibroblasts. So if you really want to do the staining to prove you are right, you need to do S100, that is patchy, CD34 patchy. EMA also stains some of the spindle cell component of neurofibroma. This one a little bit different. Still diagnosed as neurofibroma, but we can see this really distinct nodule forming this worm-like nodule in the dermis. Let's focus on the regular neurofibroma area to recap all the feature. So we do not see any growth pattern we can recognize, like storiform, vesicular growth, herringbone, of course not. We just see this haphazard growth of this spindle cell. When we zoom in, we can see this spindle cell, they do not form any structure, because we know there are three populations in the neurofibroma. So no doubt to diagnose neurofibroma. How about this area? Kind of well demarcated, but they still identical, looks like neurofibroma. So when we see this structure, we are highly suspicious for so-called plexiform neurofibroma. But plexiform neurofibroma is not a microscopic diagnosis, because when you diagnose a patient as plexiform neurofibroma, that means you clearly tell the clinician that this patient had NF1 neurofibromatosis syndrome. So when you try to make this diagnosis, just in two situations. One is that clinician already write down in the history that this patient had neurofibromatosis syndrome. and then you see this plexiform worm-like structure inside a neurofibroma, you can diagnose plexiform neurofibroma. Another situation is that when in the gross examination, they already tell you they find this plexiform structure inside this tumor. That is another possibility you can make the diagnosis of plexiform neurofibroma, because when you make this diagnosis, you already tell this patient is neurofibromatosis. So you need to bear in mind.